Hey, so you made it through the questionnaire. That's awesome. Welcome to the mini course of how to talk to clients and get them to accept your recommendations. And then once you get the patient on the table, I will show you exactly how to decide when a tooth should be extracted and when you can leave it. So I hope you enjoyed the course and I will see you later on Instagram.
Cool. So I'm calling this the client's journey to success. And when I started doing dentistry, I did a lot of mistakes with client communication also about how not to talk to clients about dentistry, what words not to use, and how to greet them, how to take them in the clinic, and how to proceed with your day. So this is a takeaway from what I've learned the past 11 years doing dentistry and speaking to clients about dental problems. So the first thing you want to do is, once the client has booked a slot for dental cleaning, then they come in the morning and they drop off the pet. So the first thing, it's very important that you spend some time. I spend about 10-15 minutes with the clients in the morning, going through what's going to happen today. So what I don't want you guys to do is to have the owner drop the pet off over the counter. So sometimes when I started, sometimes they'll just bring the dog, okay, and the receptionist would take the dog in and put it in the kennel. And then the first time the doctor saw the dog was when he was on a table. You had no chance to prepare the owner for what's going to happen. And this is the important part, preparing them what's going to happen, because owners may have a vast majority or vast variety of expectations to what's going to happen in a dental cleaning, and they think a cleaning is a cleaning, right? So but it's not really. It depends on what practice you are, what you do, and where they go. So it's not always the same. And with dental patients, we have to explain the owners that they actually have a problem that the owners did not expect. So let's say they have a dog that's limping. They come in the clinic and they demand you to fix this limp right away, but they don't come in the clinic with the dog and say, my dog has a tooth problem, or I think it has a pain in the oral cavity, I want you to fix it now. No, they usually don't, because the animals do not show any signs of discomfort. So we always find these patients while we do vaccinations or other examinations or sedation or anesthesia, and we open the mouth, we find disease nobody knew was there, and then we have to convince the owner that the dog actually has a problem and they need to come in. Okay, so we succeeded with talking to them in the room, getting them in. So no drop off over the counter, even though when the oh, what's going on? Sorry. All right. Can you see the screen? If you cannot see the screen, please speak up loud. All right, I will put a pointer here because sometimes it's not. All right, perfect. So if the client stands with the dog in the leash and says,
Martin, sorry, we can only see you.
Okay, you can only see me.
Yes.
All right. Thank you for letting me know. Let me just check here. How about now?
Yes.
Now you can see. Awesome.
It's small, but if you stop, yeah, that's better. Thanks.
It's better. Good. Thank you for your patience here. So the client that just handles you the leash and says, I'm in a hurry, just take my dog, just do the cleaning, that's fine, whatever, I'll pick it up when you call. Don't fall for this. This is a trap. Don't fall in that trap. Tell this owner, I see you're busy. Can we just spend 5 minutes together in this room, and I'll just briefly go over what's going to happen, because this is a very important step. If they don't have time, that's fine. Okay, tell them you're going to call them later. So the first thing you want to do is, like with everything else, you want to establish trust, right? And the way you establish trust, you walk up to the client, and sometimes it's the first time you see them. And you are here, first time you see this client, telling them the dog needs all this treatment done that they didn't expect. So they need to trust you first. So walk up to them, shake their hand if COVID allows it, tell them, so I say, I'm Morten, I'm the dental veterinarian here. I'll be taking care of your dog today. Then get on your knees, greet the pet, tell them how nice their pet is. And then they feel like you like them and you like their pet, most importantly, which is a very good start. Okay, so the next one is, we did that, take them to a quiet consultation room. Then something I've started doing lately is ask them, how may I help you today? What can I do for you? And even though it feels silly, because you know why they're there for dental cleaning, right? But it makes the owner open the mouth and maybe express some of their beliefs, thoughts, expectations. So it's a great idea to let them tell you why they're here. So sometimes they just say, it's just for cleaning, or they will say it has a fractured tooth, or I'm afraid of anesthesia, something like that. Okay, so it's a good way to start. You can try it out. Next part is put the patient on the table and lift the lip while the owner is looking with you at these teeth. So show the owner the teeth and the gums. And let's just say you have a dog on a table and you lift the lip and this is what you see. So what do you recommend the owner? I can tell you what I'm seeing. Let me put this laser pointer again. So here I'm seeing some slight calculus. I'm seeing some uncomplicated fracture, meaning that the pulp has not been exposed, but we miss some enamel here. But most importantly, what I'm really looking for is the gingiva. So look at the gingival edge right here and notice the color. You can see it's red, red here, red here. So there is gingivitis, meaning that this is not a preventative cleaning anymore. This is treatment because we are already in progressed disease, right? Because gingivitis is disease. The next one, I think this is what screws it up. This is the pointer. I hope you can see the arrow. If the arrow is not pointing to what I'm talking at, please let me know if it's confusing you. I have to do it like that so I can switch between slides, I think. So in this case, the margin here is even more red, right? And let's say that this owner, sometimes they will talk to another vet and they will say, oh, this is not too bad. It's just a little redness, a little calculus. Let's just, let's go ahead. Why don't you, what do they say? They say, I want you to go home and consider having a cleaning done soon. Okay. And if you say something like that, and I'm guilty of that, I said stuff like that in the beginning. And then the owners think, well, okay, let me go home and consider to have it done soon. So they go home and they consider and they consider and they reconsider. And when is soon? Is that tomorrow? Is that next month, next year? I'll just wait till next vaccination. And that's what happens when you feel like you already told this owner you need to have a cleaning done because you said you should consider having their teeth cleaned soon. But so we feel like we already recommended it. But I think all of us have tried that. Sometimes they come back 1 year after and you're like, well, I told you last year that you needed a cleaning, right? No, nobody told me, because you were not precise enough. You had this vague recommendation. So please avoid vague recommendations. Talk about there's disease present and you need to have them cleaned now. And I'll go into what specific words you should use. So, But if you have a dog on the table and you still have a little bit hard time to convince the owner about that they need their teeth cleaned, that this is what you see, a little trick you can use is you take your thumb with a glove on, preferably, and this area right here where you see this white stuff on the 208, you put your thumb and you press on that. And what will happen is some plaque and maybe some pus and some stuff, a little bit of bleeding will come out. And if you do that and the owner watches you, they will go straight to the reception and they will demand you to do the cleaning right away. Okay, so they will go and book an appointment. So it's very important that the owner sees these things. Okay, this is in a cat. And if I see something like this in a cat, this is upside down, so this is a maxilla, just a slight redness of the gums in the cat is more than enough to say there's something going on here. Normal cat gingiva looks like this, very almost pale. Okay, if you go a little bit closer, you can see, if you see something like this gingiva growing a little bit over the crown of the tooth in cats, you should be very suspicious of tooth resorption. Tooth resorption is when the tooth starts to eat itself. There's some holes in it, and it's a very painful process, even though you cannot feel anything on the cat. So you need to use words they know. Okay, talk about infection. So there's an infection of the gums. There's not calculus or tartar. Don't say there's a lot of tartar. People think if you say there's a lot of tartar, they say that's fine. Every dog has tartar. I don't care. I don't need a Colgate Smile. But if you tell them there's an infection of the gums right now, and we need to clean this tartar and plaque off to deal with it and to treat it, then it's a completely different approach. Talk about possible pain. But the most important thing here is that when you talk about pain, you have to be quicker than the owner. And what I mean by that, it's the top objection of owners, right? They say, no, it's not painful because it's still eating, right? I know it's not painful, it's eating. Don't let the owner tell you that, ever. Be quicker than them. And what I mean by that is when you say, when I'm looking in your dog's mouth, I see this problem. This may potentially be painful. And you probably didn't see any signs of pain at home, did you? See what I did there? I immediately addressed that we know it's not going to show any signs of pain. So the owner does not get the chance to tell you, no, you're wrong, it's not in pain. Because a lot of no's will, if they say, we want them to say yes instead of no, right? So be quicker than the owner. That's very important. Talk about gum recession. Talk about tooth abscess. If you mention there's a risk of a tooth abscess, a lot of owners, they have had a tooth abscess themselves and they know it's quite painful. Talk about the bacteria in the bloodstream. And we don't want these bacteria to be circling around into the kidneys, into the lungs, into the heart, and all that stuff. And so just by using these specific words, and just by spending 5 minutes or 10 minutes with the owner, see what huge difference it makes that they actually know what's going to happen, what's wrong with this dog, you know. Then they will ask, once you say something about infection, they will ask, well, so you're going to put it on antibiotics, right? No, we're not, because periodontitis is a surgical disease. You need to manually debride the tissue, the infected tissue away while you extract the teeth, and you do absolutely not use antibiotics for periodontal patients. This could be a whole lecture on its own. So I'm just going to say to you, when I started, all my dental patients got 5 days of clindamycin with them home after extractions. And then we learned more, we know more, and I found out it was really not necessary to put them on antibiotics. So I tried stopping, as people with more education recommended. And what happened? Nothing. I've never seen a post-operative infection. I do some pretty big flaps and treat some pretty severe infected mouths. and they don't need antibiotics after. They just need NSAID. Only for severely immunocompromised patients, or like severe cancer patients, or patients you put on high doses of prednisolone, they may need it. But think of it like this: when this dog comes in the door, the bacteria is already there. It has been there for months and years. Every time this dog eats, chews, or do something, touches its gums, bacteria will get released into the bloodstream. So there's a chronic bacteremia. And when you cut with your scalpel, you will induce a 20-minute bacteremia, like when the dog has chewed on something at home. And the immune system will be very proficient in removing these bacteria from the bloodstream. So giving antibiotics doesn't really make sense. So that was a short talk. But people will ask you, if you need something to disinfect, use chlorhexidine. So chlorhexidine rinse or gel to apply, which is perfect. Something that I recommend you to do is have some pictures in your consultation room. And I have these 4 pictures that I use, and I bring them up every time a dog comes in for dental cleaning. I show them these 4 pictures. And so what I will say on picture 1 here, I say, so what's going to happen today is first we'll clean and polish all the teeth. We'll get rid of all the plaque and tartar that we see and what we don't see. Then we walk around with our periodontal probe on the teeth and look for how deep the pockets are. And in this case, we found a deep pocket. And on the X-ray, we see that this root is deeply embedded in white bone, but this root has a dark circle around it. So there's lack of bone right here. And if you take this gingiva and pry it off the tooth and look behind it, you will see this red infected tissue. And then I say, this is periodontitis. This causes halitosis. So when you say periodontitis, they nod because they know what periodontitis is. It causes halitosis, bad breath. Okay, they can agree with that. This dog has a bad breath. And it may be painful. And that's when you may throw in the painful talk about that they probably didn't notice anything at home. And then you say, once we scrape this stuff out, you can see how much bone has been eaten away by these bacteria and this infection. And this tooth has been so damaged that if we found a tooth looking like this in your dog's mouth, it will need to get extracted. Okay. These 4 images, I have them on a OneDrive folder. I will make sure I will share the link with you. So you are welcome to, I will gift you these images. And so once I send my email with the recording, I will include these a link to these images in a high resolution, so you can print it out and laminate it and put it in every consultation room. So I recommend you to do that. It greatly increases the efficiency of you talking to owner about what is periodontitis. So with cats, if I have a cat in, this is the pictures I show him. I will link to this picture too. I'll give you that also. This is a cat that I took pictures of, and you can see 2 normal teeth and 1 that has some redness around it. And this redness is most likely tooth resorption. And yes, when you look at the X-ray, you can see, yes, this is definitely tooth resorption. And if you think about how I talked about X-ray, I didn't tell them, I didn't ask them, okay, so if you opt in for X-rays, then we will see this. No, I told them like it's the most natural thing in the world, that of course we'll do this full mouth X-ray. And I say once we look at the X-rays, we will see what's going on here. So to all of you who are offering X-rays, if you have X-rays, it's not all of you who has X-rays, you know, and that's fine. But then you should get it. But if you have X-ray, please don't offer it to the client, because the more things you offer, the more things they will decline. And so you should include it in the package and make it a package deal. That's what I do. And you can even do it for free if you want, because you will find so much disease that needs treatment that it will earn itself in very, very quickly. So yeah, that's my takeaway for that. So let's move forward here. Awesome. And then you ask, okay, did anyone ask you, or did anyone tell you the price? And usually they say no, even though I know that we usually tell them the price before and they get an estimate, but maybe, I don't know why they say no. Maybe they forgot, maybe they think you will by mistake say a lower price, I don't know. But a good thing to address price in the morning, that's a very good thing. So so what I say, I don't just throw out the price. Say if they ask what's the cost of a cleaning, I don't just say the number. I will tell him, I will list what I do and I will be proud of it. So you say, for the anesthesia, oral examination, clean, polish, full mouth x-ray and blood test, the cost is going to be this and this, depending on what you charge. And then once you say that, you shut up and listen and look at the owner. Because if they are passing out, falling off the chair because this is so expensive, they've never heard about it before, then you should talk about, then what can we do? Should we the only thing I will kind of include or exclude is the blood test. I don't want to miss out on x-rays because it's so important. If you work with internal medicine, you'll probably skip the x-ray and keep the blood test. It's just the way. But I recommend you always to do the full mouth x-ray. And when you talk about the price, this is the way you say it. And then they say, oh, the vet downtown is half that price. It's a cleaning too. And then if they say something like that, you just say, I don't know what this other vet is doing, but here in my practice, this is what we do. We have invested in monitoring equipment. We have a nurse that is looking over the dog. We have a bear hugger blowing hot air. We are doing all of these things, educating ourselves, investing in the safety of your pet. And this is our price. So you don't go into any discussions about what anyone else charges. Just say, this is what we do here. And if they still want a second opinion, a second price, or a phone around to get other prices, then I would just let them know, say, this is perfectly fine. I think it's great that you are looking at the market, what's available. Just make sure you ask the vet, do you make full mouth x-rays? Do you do this and this and that? I usually just make sure they take x-ray of the whole mouth. So because it brings to the owner's attention that, okay, maybe a dental cleaning is not the same everywhere. And who expects owners to know that? They don't know it. They think it's the same. Like when I go to the mechanic, I expect them to find out what's wrong with my car, right? I don't know if they use electronic devices to find out, or they look underneath the car. I don't care what they do. They just need to find out what's wrong with my car and if there's anything wrong. And it's the same expectation that the owners have. So then I say, if you find anything else that requires treatment, you'll get an estimate before we proceed with any treatment. So I'll give you a phone call. Please be on the phone, and I can reach you to talk about what needs to be done. Okay. And that's if you are doing if you're doing treatment the same day. Some people recommend staging the procedure, meaning that you only clean and polish an x-ray diagnostics on the first visit, then you wake the patient up, then you make your chart about all the things that needs to be done, take your photos and all that stuff. I'll get back to that. And then you show it to the owner and make a plan, have it come back, and they already seen the disease. They don't feel pressure over the phone to accept something. It can be better in some practices. Either way is perfectly fine. It depends on what you want to do. If you're in a practice where you always see consultations in the afternoon after dental cleanings, you may have experienced a lot of stress because you all know that when you're in a hurry, that's when you start to break roots, then that's when complications happen. And that's when you don't have time for your lunch, you are late for your appointment, everybody's angry because the appointment is delayed and the doctor's on the table is prolonged, and it's a bad experience. No matter what you do, I just encourage you to do one thing, and this will dramatically take some of the load off your shoulders and the tension and the stress you experience during the day. So here it is. Buy yourself some flexibility. And what I mean is that you tell the owner in the morning that we don't really know how much disease that we find. I can obviously see some teeth here that needs extraction. We can all see that. But if there's a lot of stuff extra, I don't know. So what I tell the owners, I say, if I find something that's relatively quick to do, then we have time today to do the treatment. But if we need to do surgery, then we will have you come back another day to do that, because we don't want this extremely long anesthesia, and I want to have enough time for your pet. Every pet owner wants you to have enough time for their pet, right? And they don't like long anesthesias. They don't like 2 anesthesias either. So it's a little bit of mix. I should recommend you maybe to, when you bill them, take away the induction fee on the second bill, because that may take away some of the complaints you may experience, that why are we paying for induction twice? So that's just a tip. But just by buying you some flexibility, because if it's 12 o'clock and 12:05 you have a consultation and you are near way done, you're not done with this dental patient yet, then you just say, okay, it's fine, we'll stop now. I already warned the owner that we may not finish today, so I'm not feeling stressed about that. I have to call them and say, oh, I'm sorry, I did a bad job, I couldn't do all 30 teeth extractions today. You don't have to do that. And the owners will accept it, and in my experience, they will always come back to have it done. They don't want to go somewhere else to start all over explaining, and they may need new x-rays and all this stuff. They don't want to go to somebody else. They want to come back to you because they trust you, because you showed them so much stuff and talked to them so much. So just by spending those 10 minutes with the owner, you really set yourself on another level than most clinics do. What I'm really stressing is the use of clinical photos, and I'll show you exactly how I do that. So they get some discharge papers once they pick up the animal. And again, if you have any questions, put them in the chat. I will take them. I'll take them later, or speak up when there's time to do questions. So this is what I include in my discharge paper. So I like to take some clinical photos of what I found. I don't take a lot of before and after photos, because if we need to have the dog come back for something and you gave them an after photo that looked pretty, then they will look at the photo, they will see, no, we don't need to come back. It looks nice. Okay, let's just wait. So don't do that. Just give them clinical photos of stuff that's wrong. In this case, the fractured tooth, they can clearly see the pulp. And I gave them a picture so they can see the after with the stitches, so they know what to look for. This is some other pictures I took, and this is a brachycephalic dog. And what I do, I always probe and do the probing first and then take the pictures, because if you can get some blood on the pictures, it will work more effectively. And as you can see here, if you show the owner this on a picture, they will beg you to treat it, okay? But if you just tell the owner, oh, it had a lot of periodontitis, we need to extract 3 teeth, could be these 3 teeth, they will think about it. They don't know what periodontitis looks like, so they will be not as they will be hesitant to do it. But if you show them a picture of this infection, they will always come back and they will have you to do this. So I like snapping photos of just selected diseases. And here's what I do, how I take these photos. Everybody has a smartphone, and usually when you take photos with a smartphone, it's not the best quality. And so something you can do that will dramatically increase the quality of the photos you take is go to your kids' room and find this selfie ring light they keep, or go buy one for $2 at the store and put it on your phone. And this will dramatically increase the quality of your photos. And once the owner sees photos, they will understand what's going on. They will understand the value of your work. They will understand why you charge so much, because they have seen all the disease. So you make everything easier if you just spend some time to snap some photos. These small ring lights is okay, but the one I really recommend you, this is the one, this is the one I use. This is called a Godox M32. And I'm not sponsored or anything. I just love this little device. It costs, I think I only paid maybe $20 or 20 euro for this. It's rechargeable and you can get it in just about every country. Search on Google for Godox M32. And this, once you click it on your phone and turn it on, it has a very powerful light. So take the overhead light you have and remove it away. Don't let the overhead light shine on the teeth. Just use this light. And you will see a dramatic difference of quality. And you can even start to take photos into the mouth, which may have been difficult to get before, and get a nice focus. So I have a huge recommendation for that. Once you start to get a little bit more nerdy, then you do what I did. I stole my wife's old beat up camera and I bought some accessories to make it a macro camera to make nice pictures. And then I upgraded it even more to a professional setup that I have right now. You definitely don't need that for the owners, but once you've had it, it's hard to go back because the images are just extremely crisp and you can zoom in and it's very nice. But you all say, that's fine, Morten, with these pictures, but how are we going to find time? How are we going to print them? How are we going to do all this stuff? It takes too much time. I hear you. I found the solution and I use this app. It's called Print to Size. And what it does, it just gives you an A4 sheet on your phone, and you can just import pictures from your camera roll into that and arrange them. Then you have Wi-Fi at your clinic, and most printers today are Wi-Fi, which means they can connect directly to your iPhone if you're on the clinic's Wi-Fi network. And that's very smart, because then you can print pictures directly from your phone. Preferably a laser color printer. This is the best, laser color printer. So what I do, this is my home screen, and you can see I have this app right here. So I open this sheet of paper and select some photos. And these photos are, I like to put some mug shots on my folders that I send home for the patients. But this could be pictures of teeth. So see how easy and quick it is just with my finger to rearrange these photos on this piece of paper. So very easy. So this is the layout that it will get printed at. Then I hit print, or you can even, as you see here, you can export as PDF. You can send it in an email to the owner, which is very quick, or you can print it at your printer. And then you pick it up in the printer, and this is when it gets old school. I take a pair of scissors, I cut the pictures out, I use a stick of glue, and I put it on this folder. And some people may think this is a little bit silly, waste of paper and all this stuff, but imagine picking up your dog from the dentist and you get a folder with discharge paper with a custom photo. It's even your own dog that's on the photo. This is how much my veterinarian loves my dog. He takes a photo, puts it on a folder, and this is just amazing. I'm never going anywhere else. This is the effect we want from these owners. And this is the effect that we also get sometimes. And when they go, they say, this was quite expensive today. Let's try a cheaper option next time. You can be 100% sure that if they go for a cheap option, they don't get anything like this, and they will come back to you because this was more professional. So this was just some hints to, you know, some thoughts about how I approach clients when dealing with these dental patients. I hope this can give you some tips and tricks and some words to say and some things to how you can improve your communication with the owner and make yourself stand out from the crowd of clinics. So I also submit some x-rays. This is just from the x-ray software. It's able to do this by itself. I don't expect the owners to look at these pictures and know what they're looking at, but I like to have something to point at while I send the patient home. I also have a discharge instructions. And what you can do is you can have the patient's name be automatically put in this document when you enter the name. So you can do that in Word or probably other software too. And this is just a good thing because it says the animal's name and not just it or the dog or patient, something like that. Okay, so this was part one. Let me just briefly check some some questions. Corina asked what dental chart to use and do you send the chart to the owners? I have the EVDS, so it's a European Veterinary Dental Society one that I have modified a little bit for myself, but I use that chart, EVDS. If you search for that, you will be able to find a chart. And I don't send the chart home with owners because I write some codes and some numbers, and I don't. It's my document. I don't expect the owner to really find it useful, and I don't want to spend time on it because I want to spend time on photos. And I think you should really prioritize photos instead of charts, colored overviews of teeth, what teeth are have what diagnosis, and people just want to see a photo. Okay, it's pretty easy. Could you please send the name of the printing app? Yes, it's called Print to Size. Okay, you find it in the App Store. And iPhone says, this is amazing tips. I love it. Thank you. Thank you. So what time is it? I can't see on my screen. How much time do you have? About 20 minutes. Okay. So now you have the patient on the table. And the next thing I just want to briefly talk about is that's something that can be a little bit subjective, right? Because back in the day when I started, I was taught that if a tooth is loose and mobile, then it needs to be extracted. If it's completely stuck, then it's fine. And that was before the days of full mouth X-ray, where we found out that even if a tooth is not able to move, it may have periodontitis, may be diseased. So when should we extract the tooth and when can we leave it? This is just a brief overview of that. So you get the patient under anesthesia. You need these instruments. So this is a periodontal probe. You need sometimes a mirror, can be handy in some situations, and you need some nice curettes. I'll just zoom in here so you can see the name of this curette. This is what I use in the back of the mouth on the distal ends, so the back side of the teeth. You can see the numbers here. You can search them on Google. And this is what I use in the front of the mouth. And it has something to do with the angle here that you can approach it. And what I use a curette for is if you find a pocket with your periodontal probe, it's not enough just to go down with the ultrasonic scaler. It will not get rid of the granulation tissue and stuff that's down there that you need to get out to do a proper job. So you need something sharp to put in there. that you can scrape against the tooth and scrape the stuff out. So these are called curettes. Okay, so let's just say that you don't have X-ray and you need some sort of measurement to say, okay, this is when we should start considering extracting a tooth with periodontitis. So when you have a cat and you have a 2 millimeter pocket, that's nothing, right? But in a cat, it's actually a lot. Then you may consider extraction. If a dog has more than 5 millimeter pocket, you may consider extraction, or at least opening up the tissue, make an open root planing, meaning that you make a flap and you clean up the tooth and then you close the flap again, which is getting us more into advanced stuff. But let me get you some examples. What I do, and I think is very important when you examine the mouth, is you probe before you clean. I start with full mouth X-ray as the first thing. I don't care if there has calculus and tartar on the teeth. I can see what I need to see below the gum line on the X-rays. You can see a shadow on the teeth, which is the tartar, but what you need to see is bone loss and so on, which is very clear on the X-ray. So I do that first, then I put it on the back and I start to use my periodontal probe around the circumference of every tooth. So I measure the pocket depths all the way around the tooth, and I note on my dental chart what the pocket depths are. I don't note when it's normal. So below 3 millimeters, I usually don't note. So see, in this case, the probe went straight through this tooth. And this is the rule of thumb. When it does that, you have to extract. There's no saving such tooth. It's extremely complicated to try and do it. You need an owner that can brush every day, that can do all you recommend. And if it got to this point in the first place, they are probably not prone to brushing anyway. So this is the way I like to keep them on the back, because it's so easy for me to see the entire mouth. You can just put the head from side to side and see everything. And let me see the next one here. Okay, what I'm looking for is signs of when should we extract a tooth, right? So in this case, when you see pus here, this is some bleeding and some pus. I only touched it slightly with my periodontal probe. Then you know there's a pocket here. Okay, there's going to be pus there. If we just clean this and send this dog home, you can be sure that within 1 week there's pus again. And this is a progression. So in my opinion, you should really extract this tooth. We didn't even take an X-ray yet, but just by knowing this, I would extract this tooth. I know it's going to be a problem. The reason why it's such often a problem between these teeth is the lack of a gingival collar. And a gingival collar is the gingiva that surrounds the teeth. Every tooth needs gingiva, like in this case, to surround the tooth in order to be healthy. And when they are crowding too close together, there's no gingiva protecting each tooth, so it will collect dirt and stuff. In this case, we have a nice gingival collar. So this, for a change, this is a healthy intersection between these two teeth. There's usually always a pocket here. But look at this. There's no gingival collar. The teeth are contacting each other, which means that there's going to be pockets and disease. So you may consider extracting this one, even without taking an X-ray. This is something I just want to show you, because this is a very, very rare case. This is a brachycephalic dog with crowding, but a gingival collar around every tooth. So this is first, only and last time you'll see a brachycephalic dog looking like this. This is the 1 in a million case where it has not enough room for the teeth, but they are actually very healthy because there's a gingival collar around every tooth except here. So look for this. This is a sign of health. Once you have a furcation exposure, so as I said before, this is an extraction. You don't need an X-ray to say that. When you have gingival recession like this, so the gingiva, what's supposed to be across here, it has pulled back, then you look at, okay, how much gingiva do we have left? And what I mean by that is, how far is the distance from the gingiva here to the margin between the mucogingival line. And the mucogingival line is where the gingiva becomes mucosa, which is the soft part here, and the gingiva is solid attached to teeth. So you need at least 2 millimeters of attached gingiva for a tooth to be healthy. So in this case, there's more than 2, so this tooth could be saved. But just tell the owner that there's root exposure, meaning that the surface is going to be rough and you need to brush it to save this tooth. If they're not going to brush, then this tooth eventually will become so bad you need to extract it. This is a case, another rule of thumb. If your periodontal probe goes all the way beyond the mucogingival line, which is this line, go all the way up here into the mucosa, like you see, this is the depth that I've reached, then you have to extract. And I know it's a pity, it's a nice looking canine tooth. It's such a good big tooth and you want the dog to keep it. Just keep in mind, if you can probe through this line up into it, don't force it through, but if it just slips into and slides all the way down to there, you can be calm and have confidence and tell the owner, this is not going to get better. There's no possible way you can clean it. If you want to clean this, you have to do advanced regenerative procedure to save this tooth, which is often not feasible. So in this case, it's an extraction. So it's easy rule of thumb for you guys. Let's look at the cat with the 3 millimeter pocket. Okay, 3 millimeter is nothing, but in a cat, it's actually a lot, because look at this on the x-ray. You can see this is the space, the spot where we did the probing, and you can see almost half the root's length. Let me go back. Almost half the root's length has been exposed. And we look at the bone loss. And the way I look at it is I see this gray area, which is loss of bone, so the dark area here, and you see and you always go for the deepest part. But you can see the upper part here, there's a line, and then there's a line here. And that means that, so the surface of the bone is not horizontal. It may be oblique a little bit. So that's why some part of this root has been exposed all the way down halfway, and others not so much. You can see what it's supposed to look like here with this spike. So this is pretty bad. So see how much info we can get just without looking at the mouth without even taking a single x-ray. But we want to go a little bit deeper than that, don't we? So we would like to get some help to how to interpret these x-rays when talking about periodontitis. And the way you do it so it becomes not a subjective measurement, but an objective, is you use this formula. So PD2, 3, and 4 is the things you will write on the chart. 2 means less than 25% vertical bone loss. PD3 is 25 to 50. PD4 is always an extraction. It's more than 50% bone loss. And it looks like this. PD2 up to 25% bone loss. And what we mean by 25% is you take the length from where the crown stops to where the root tip is, and this is 100%. Okay. So if you have a shadow down to here, this is within the green zone, this is 25% bone loss or less, meaning that you don't have to extract. You can go down and clean with the curettes that I showed you. And then you can take the dog home. If you go down in the yellow zone, then it's almost half the root length that has been exposed. And once you reach your yellow zone, it's often an extraction, unless you have an extremely dedicated owner who can brush every day and come back for cleaning in 3 months again. And so usually it's an extraction. If you go in the red zone, where you see the shadow extend all the way down, more than 50% bone loss, then you have to extract. Okay, so this is some 3-step way of knowing when to extract and when to keep. These are some examples. PD2, you can see the shadow go down to here. The lowest part, don't look at the opposite, look always at the worst part. So the lowest part here, and this is PD2. PD3, you get close to 50% bone loss on this root. And so I would extract that to try and save this one. In this case, you see PD4 because you can see that the dark area here circumferences this root, and more than 50% of bone loss has been happened to this root. And here we are almost at 50% also on this root, and a focation exposure. So you need to extract that tooth, obviously. And this one has a guarded prognosis. But if you can go down and clean this up, if you just pull this out with your finger, if it's that loose and you just pull this out, do nothing else, then you have not really helped this tooth. And you need a miracle for this tooth to be healthy. But if you extract this and you go down with your curettes and you clean out this area for granulation tissue and infected tissue and so on, then you may save this tooth. So next slide. PD3, in this case, this is a distal root. You can see that the bone loss is almost at 50%. What I would do is I would extract this tooth, the 3010, and clean out this area so you can save that. But if you have a PD3 where there's no tooth that you can remove to try and hope for healing, remove any obvious cause that can make it better. There's no obvious cause here. This is just, you would have to extract this one. I would extract that tooth, definitely. PD4, again, this is an example. And I want you to look at something here. I want you to look at the periodontal ligament. And the periodontal ligament is that black line surrounding the root right here. It's a very thin black line, and all roots needs to have one. And you see the thin black line here, but here the line becomes very thick, and that means that periodontal ligament space has been opened up. Okay, so it means that there's bone loss all the way around this root, and this is a PD4. And if you push down on this tooth, it will most likely be a little bit mobile. So you have to extract that also.
Hi again. I hope you learned some nice tips and tricks you can start using tomorrow when you see your next dental patient. And if you like my way of teaching and the way I explain things, I have an offer for you. I'm inviting you guys to join me in a coaching program. I call it the 6-week coaching program. It's a program where you and I work closer together to make you able to achieve your goals even quicker. And you can do it online. So the program consists of lots and lots of nice videos, narrated videos that you can go through at your own pace. You will also have access to a Facebook group where you can discuss all the cases you want. And once weekly, we have a live Q&A session where we discuss what you are struggling with. And it's a small community, so you can comfortably ask all the questions you want. No questions are too little to be asked in this forum. I want it to be a safe learning experience for everybody. So the course consists of 6 modules. In week 1, we will dive deeper into client communication, how to really get those clients on board like you just saw in this lesson. Week 2 is all about the cleaning, the charting, what equipment to buy, how to maintain your equipment, how to sharpen your instruments, and so on. Week 3, we'll go through radiographic technique, how to do full mouth x-rays in less than 10 minutes. Week 4 is all about making your dental day less stressful. Having a dental patient on the table while they come up from the reception telling you, oh, your next consultation is waiting for you. It's very stressful. And I will teach you how to make some healthy boundaries that will make you able to have a very stress-free dental day. Week 5 is the big surgical week. I will share with you step-by-step video guides exactly how to extract all the certain teeth you need to extract. And week 6 will be an introduction to advanced procedures, so talking about bonding, talking about jaw fracture repair in the general practice, and much more. So let me know if you're interested in joining the 6-week coaching program, and I will see you later on Instagram. Bye bye.